The first paper I want to share with you is a paper from 2022 by an Iranian group headed by Dr. Loftidazeh. And this is a very interesting paper because it just summarizes in a nice way the mechanisms of action of ivermectin in cancer. It acts on these signaling pathways called PAC1 and ACT and mTOR and WNT pathways. These are pathways that are involved in tumor proliferation, tumor growth. And so ivermectin inhibits multiple of these pathways that inhibit tumor growth, tumor proliferation, leads to cell cycle arrest, and it also inhibits metastases and the ability of the tumors to create blood vessels for themselves. So that is key. Multiple pathways that inhibit tumor growth, tumor proliferation. Then ivermectin also acts on cancer stem cells. It inhibits cancer stem cells. And cancer stem cells are extremely important because they are involved in the aggressiveness of cancers. They're involved in metastases, and they're also involved in cancer recurrence. So imagine you get chemotherapy, you think you've been cured, but cancer stem cells tend to be resistant to chemo, and then your cancer comes roaring back because these cancer stem cells start proliferating again. So it inhibits cancer stem cells, very important. Ivermectin also stimulates cancer cell death, stimulates apoptosis, autophagy, other kinds of cancer cell death. Ivermectin also reverses multi-drug resistance. So if you develop resistance to certain chemotherapy, ivermectin will reverse it. And ivermectin acts in combination with chemo or radiation therapy. So it has those additional benefits as well. Another great paper is a paper by Guzzo from 2002. And this was basically a safety study on ivermectin. What kind of a dose of ivermectin can you take safely? So in this paper, they looked at 30 or 60 milligrams 3 times a week, or 90 or 120 milligrams as a single dose. And basically, the conclusion was that ivermectin was generally well tolerated with no indication of CNS toxicity. So this is neurological toxicity for doses up to 10 times the highest FDA-approved dose of 0.2 milligrams per kilogram. So 10 times that would be 2 milligrams per kilogram. Remember this number. They've shown that ivermectin is well tolerated up to 2 milligrams per kilogram per day. And the approved dose is, of course, as an antiparasitic. It's 200 micrograms per kilogram or 0.2 milligrams per kilogram. Well, you need a higher dose for cancer effects. So again, ivermectin generally well tolerated at these higher doses and more frequent regimens. So a very important study showing safety of ivermectin at higher doses. Next, you want to look at whether ivermectin has actually been used in cancer patients at the higher doses and whether those doses were safe. So a great paper on this is a paper by Claudio Castro back in 2020. And this paper looked at using high dose of ivermectin in children who had leukemia. One of the children was an 11-year-old boy diagnosed with an extremely aggressive leukemia, and they gave him 1 milligram per kilogram once daily, so per day, with chemotherapy. And what they showed was that he started feeling better, and the blasts, which were the leukemic cells, were cleared from his blood. Now, they only gave it for a short time with the chemo. Then, he eventually started getting worse again. So they resumed ivermectin 1 milligram per kilogram for another 6 months. And then he had stable disease for a surprisingly long period of time. So this 11-year-old boy was taking 1 milligram per kilogram of ivermectin daily for 6 months, and he had no side effect. His only therapy-related complaint was that he didn't like the smell. So no side effects whatsoever at 1 milligram per kilogram. This is very important because this actually gives you an idea of what doses should be used.